Welcome to The Explainer. Today, we're diving into a health guide from Elevate Health Group to look at something pretty amazing, the modern comeback of doctor house calls, right here in the Los Angeles area. We usually think of house calls as this charming relic of the past, like something straight out of an old black and white movie. But actually, recent shifts in primary care have brought this super personalized service right back to the forefront. And honestly, if you've ever dreaded that stressful traffic-clogged drive to the doctor's office, especially if you've had to battle the 405 when you're feeling under the weather, well, you're definitely going to want to pay close attention to this.
So, here's our roadmap for today. We're covering 1. The modern house call. 2. What to expect at home. 3. Who benefits from house calls. 4. Costs and insurance coverage. And 5. How to schedule a visit. Let's get right into it.
Look, we've literally all been there. You're feeling absolutely awful. Or maybe you're juggling a crazy schedule, or dealing with some mobility issues. The absolute last thing you want to do is drag yourself out of the house. Finding parking, sitting in a sterile room, coughing alongside other sick people, and then waiting way past your actual appointment time. It kind of highlights a glaring absurdity in modern healthcare, right? The sheer logistics of just getting to a doctor adds so much unnecessary stress to a situation where your body really just needs to be resting. But here's where Elevate Health Group comes in with a really compelling alternative. They're essentially offering a trade. Ditch the physical strain and lost time of a traditional clinic visit and instead get comprehensive, evidence-based medical care right in your living room. It's a total game changer because it fundamentally flips the traditional healthcare model on its head. It prioritizes your comfort and your time over the clinic schedule. And the best part? You're not sacrificing a single ounce of medical expertise.
All right, moving into section 1, the modern house call. Now, you might be wondering, is this legit? Well, you absolutely aren't sacrificing quality for convenience here. These at-home visits are conducted by board-certified primary care physicians. We're talking about highly trained internal medicine experts who stay constantly updated on the latest healthcare developments through ongoing medical education and research. Basically, you're getting top-tier, evidence-based medical science delivered straight to your sofa.
And as for where they operate, Elevate Health Group serves the greater Los Angeles area, specifically directly covering patients throughout Glendale, Burbank, and La Cañada. What's really cool is that they actually operate out of 3 modern medical facilities. So having these established, state-of-the-art physical clinics backing up their mobile services means there's this incredibly robust, reliable infrastructure supporting every single house call they make across these communities.
Which brings us to section 2, what to expect at home.
The crucial takeaway here is that they literally bring the clinic to you. The medical providers show up with the right equipment to do comprehensive physical exams, check your vitals, draw blood for labs, and actively manage complex chronic conditions like diabetes or hypertension. It covers the whole shebang, from medication reviews and vaccinations to post-hospital follow-up care. It is an entirely comprehensive primary care experience, which means you can pretty much say goodbye to those repeated, exhausting clinic trips. Now think about the number 30 to 60. That is the typical number of minutes one of these visits lasts. 30 to 60 minutes. That means you're receiving incredibly thorough, personalized, and, most importantly, unhurried medical care. Unlike those standard, often super rushed clinic appointments where the doctor is just trying to manage a packed waiting room, your visiting provider actually has the time to sit down, really listen to your individual concerns, and build a highly tailored treatment plan just for you.
Let's move on to section 3. Who benefits from house calls?
Honestly, the benefits span a wide range of situations. Whether you're a caregiver trying to manage care for an elderly family member, someone recovering from a recent injury or hospitalization, or literally just a busy professional, house calls directly solve the major logistical hurdles of healthcare. If mobility is an issue, boom, you completely eliminate the physical strain of traveling and waiting. Managing a chronic condition, you get essential, regular monitoring without the commute. It's really all about designing healthcare to fit seamlessly into your day rather than forcing you to hit pause on your entire life.
Okay, let's tackle the elephant in the room in section 4, costs and insurance coverage.
It's super common to worry about the cost when you hear about a premium service like this. But you can actually rest easy. Elevate Health Group accepts all major insurances. And yes, that includes Medicare and PPO plans. Even better, they proactively verify your specific coverage before you even schedule the appointment, so there are absolutely no surprises. And if you don't have insurance, they have clear self-pay rates available too, ensuring total financial transparency. Basically, as long as the house call is medically necessary, it's often covered exactly like a standard in-office visit would be. How great is that?
Finally, let's wrap up with section 5, how to schedule a visit.
The whole process is literally as simple as 1, 2, 3. It all starts with a quick phone call to 818-246-8000 to review your medical needs. This step is key because it ensures the staff can verify your insurance and the doctor knows exactly what supplies and diagnostic equipment to pack before they arrive at your door. They take the time up front to understand if it's a routine checkup or a specific sick visit, so when they ring your doorbell, they are 100% prepared to treat you effectively.
Oh, and this is a huge plus. Same-day visits are available. If you suddenly get sick and need urgent care, they can generally accommodate you, especially if you call their office early in the day. This kind of operational flexibility means you aren't left waiting weeks just to address an immediate health concern.
So, are you ready to skip the commute and take control of your health today? With evidence-based, board-certified care now available right in the comfort of your own living room, the traditional waiting room is starting to look entirely optional. As medicine continues to become more personalized and way more responsive to our crazy schedules, I'll leave you with this final thought. Is the ultimate future of healthcare actually rooted in its past? Thanks so much for joining me for this explainer, and I hope this dive into modern house calls helps you take charge of your own healthcare journey.